Welcome to the Womanhood Podcast. I'm your host, Shannon, Somatic and Energetic Integration Specialist for Women, Foundress of Somatic Body and Creatress of the SomaCycle method and the Feminine Harmony program. And I'm here to inspire you to reclaim your rhythms, remember your wisdom, and root into your womanhood. Each week, I'll be discussing topics centered around our womanhood from a multifaceted somatic and energetic viewpoint, weaving together both science with spirituality and masculinity with femininity. We'll be talking cyclical natures and rhythms, intuition, instincts, ancient womb wisdom, and grounded embodiment strategies. Find yourself a cozy space and let's get started. What if we looked at pain as something to listen to rather than something to fix? And yes, what you're looking at if you are not listening but watching this podcast episode is a new hairdo. This is not a wig. It is very beautifully made by my hairdresser, who is also my sister-in-law. And for those of you who are listening and can't see this, I now have blonde hair. I've been a brunette for like 6 years with a little bit of blonde highlights, but this is like fully blonde hair now. Going from a dark brunette to a light blonde is quite a change, so I thought I'd just point that out before we get started. But we're here to talk about the pain body. We're here to talk about pain, familiarize ourselves with pain, and start to look at the body's pain and discomforts in a way that can actually empower us. So let's get into it. Now, when it comes to pain, our immediate reaction is to hate on it, of course, because it's not comfortable. It's not a nice human experience. And when we're going through it, in the midst of it, it is really hard to appreciate pain. But if we can tolerate the pain or the discomfort to the point where we can start to consciously choose to tap into the information that pain is giving us, it gives our mind something to focus on, something to rationalize, and takes the emotional charge and the emotional reactivity out of the equation, which is often why we don't like pain and discomfort, is because there's this emotional charge of like wanting it to be over and just gone. We take that away and we come into that logical part, that masculine part of our mind, as well as the feminine aspect of the mind of surrendering to what is. So there is also, and I like to bring masculine and feminine essence to everything, there is a dynamic duo within our right and left side of our brains, and also the different parts of our brain that are classified as the more kind of logic and practical aspects, the masculine mind, and the more dream state surrender, those aspects of the mind. And so when we start to think about it this way and how our brain communicates with our body, we can start to tap into discomforts and pains on a whole new level. We're starting to look at the brain and the nervous system as our messenger system of the body. And we can start to think of pain and discomfort as signals from our nervous system alerting us. It's giving us information. And not only that, it's giving us information that we can start to interpret even if we don't have a huge foundational understanding of anatomy and physiology. We can look at this from a psychosomatic perspective. We can start to look at this outside of what medical and health professionals can provide for you. Still go and see them. I'm not saying don't. What I'm saying is when we're in the midst of discomfort and pain, so long as you've had major red flags and yellow flags looked at and cleared by a medical practitioner or whoever it is that you see, a health practitioner, a homeopath, a naturopath, whoever it is you see, clear your condition. Know that on a physical body level, an anatomy and physiology based level, it's taken care of. Say you still have discomfort and pain. Say you have chronic pain that you're dealing with. We can start to look at the metaphysical aspects. We can start to unpack the pain and discomfort that comes with chronic pain and also unexplained discomfort and pain as well. As in, I've had this checked by medical professionals and no one knows what's going on. It's idiopathic. In other words, we don't know what causes it. Or it's a syndrome, which basically is a word for idiopathic. We don't know what causes it. It's just very common, so we call it a syndrome, so everyone thinks, okay, it's a condition, but we still don't know quite what is causing it, right? And so when there is an unexplained condition in the body creating discomfort and pain, the first response is to get agitated. That's an emotional reaction. And it's totally normal. And we're not here to shame that, and we're not here to stop that from happening. What we are here to do and talk about in this podcast episode is to talk about how we can shift from that emotional reactivity, that initial response when we are in pain and discomfort, so long as it feels safe in the body to do so, as in we either have a physical body explanation from a professional, a medical professional, we've done that work, or we already know what's going on because it's chronic pain, we're familiar with it, right? We know this pain well. So when we're in that state of going through the pain and the discomfort, and we feel safe enough to delve into the metaphysical aspects, those unexplained aspects that talk about the stored emotions in the body, the stored thoughts and beliefs in the body, the stored energies, that energy exchange that we have from within and without. You know, when we're in energetic exchange with others, we can have this exchange of energy. One example, when I first came to realize this, was my best friends and I was on my bleed. It had just started, and I was just kind of like hiding my cramps. They were mild cramps, they weren't that bad, but I was just kind of like hiding my cramps, enjoying the moment with her. I was in my mid to early 20s, and she kind of just like, we were just cooking in the kitchen, and she stopped and looked at me and she goes, "You got your period?" And I was like, "Yeah, how did you know?" She goes, "Oh, I feel like I can feel that, like I'm tapping into that," right? And so that's that energetic exchange. She's tapping into my body and picking up on that. This is someone who's very close to me. And that was the moment I realized, oh, we can really pick up on other people's energy, other people's sensations, other people's thoughts and beliefs and emotions. And in that example, that's not necessarily an invasive or negative example, as in it's not affecting me negatively. She felt the discomfort in her body, quickly identified that it was mine, and was able to detach from it. That is a healthy exchange of energy. It's when we have this unconscious energetic exchange, we're tapping into other people's energies and absorbing that, or vice versa. We are releasing our energy onto other people and they are allowing us to do so, right? It's not just, it's always a two-way street. But when it comes to these energetic exchanges, that's the energy, I mean, that can be exchanged and stored within different bodies, stored within each other's bodies when we know each other, or when we're touching, when we're surrounding, even during intimate situations where we're hugging people, holding hands for long periods of time, sex, intercourse. It's all energetic exchange. And not just energy, it's what comes with that is the emotions, the thoughts, the beliefs, even the words that we hear as we're developing, whether it's from teachers, friends in school, family members, it's all taken into the body. And when we shame certain parts, or we feel like it's too much for us to deal with, we push it down. Or some people say bottle it up. Phrase it however you want, but it gets stored in the body. The things that we don't deal with, or we feel like we don't have the capacity to deal with them at that point in time, whether it was when we were a child, earlier, when we were an infant, when we were a teen, as an adult, it still could be going on, but we're unpacking that when we start to listen to the language of our body. Inner Segal, that's a quote. She has an amazing book on this. I'll pop that in the show notes as well. But The Secret Language of Your Body by Inner Segal, and this interaction that I had with my friend in my early to mid 20s, where she picked up on my bleed. These were partly the key moments where I first tapped into the fact that we do have more than just physiological explanations, medical and healthcare explanations to what is going on with our body when it comes to pain and discomfort and signs and symptoms in the body. Our body is really intelligent. It likes to preserve our lives. Its whole point is to stay alive. And so it is going to signal to us when something is off. And this should be the number one, first and foremost, most important thing to follow over medical advice, over healthcare. Follow the instincts of what your body is telling you. And if something is very wrong, trust that your body will tell you something is very wrong, and trust to follow that. Now, what I mean by that is, if something feels certainly wrong and it is excruciating pain, your body is going to tell you that. And you are going to know to go to a medical professional. You are going to know to go to the ER. You are going to know to see a healthcare provider. And that's what I mean by trust. Put your trust first and foremost in what your body is communicating to yourself. Don't just go straight to one quick fix, or one band-aid over the counter fix, or one quick solution over at ER, when you can actually stop for a moment, pause, and really start to rationalize where this is coming from as well. Check in with your body first and foremost. That's the first thing I would start with when it comes to making friends with our pain and making friends with our discomfort, and learning to listen to the language of it, starting to interpret what our body is communicating with us. And when we do start to put our body first, you know, listening and trusting the body and what it has to say with us. When we do start to put that first, this amazing thing happens. We start to develop a compassionate relationship with our body. And so if you're someone who goes through chronic pain, or has been going through chronic pain for many years, many months, this is a key factor, is healing your relationship with the pain and discomfort of your body, learning to communicate with it, And this will actually impact the way in which you perceive your pain and the way in which you perceive your discomfort. In other words, your pain may decrease the more you start to understand pain. I know for myself, when I've been in moments of pain, my pain-ometer is right up there, 10 out of 10 if I'm in like excruciating pain. But then all of a sudden, once I start to understand what it is that's causing my pain, say I take a moment to check in with my body, or a healthcare professional explains what's happening to me, my pain-ometer goes from 10 out of 10 down to 8 out of 10, and then my nervous system calms and has time to register, and then it goes from 8 out of 10 down to 6 out of 10. That's an example of experiences that I've had just from doing that number one thing I talked about before, which is checking in with your body and trusting what it's communicating with you. And also, if a part of that is seeing a healthcare practitioner or a medical practitioner, that can help you understand your body as well on a physiological level, an anatomy and physiology level, then that will also be helping you as well. The second thing, or my second pro tip, number one was listening to your body, always trusting their body, starting to build that compassionate relationship with your body. Number two, I would say, is to familiarize yourself, not with the full anatomy and physiology of the body. You don't have to do that. You can if you want to, but at least understanding how pain works in the body. So we're going to get into that now, because pain isn't actually happening where the pain is felt in the body. You might think it is. So say you have a sore back. You might think, okay, I have pain in my back. But what happens with pain when it comes to generation of pain is it doesn't actually come from the lower back when you're experiencing pain in the lower back, for example. What's actually happening is there is a certain tissue that is disturbed, that is not in its normal state, whether it's from trauma or an inflamed disc or a angry facet joint, a joint that's not happy, whatever's happening in the lower back. Say there is pain. It is the tissue that is affected, inflamed, damaged on some level, disturbed on some level. There is a level of dis-ease in that area of the body. It sends the signal up to your brain that this particular tissue is going through this type of disruption or damage, whatever that may be, inflammation, swelling, physical tissue from trauma, degeneration from trauma over time. It sends that signal of what's happening to the tissue up to the brain. The brain, being the control center of the body, then interprets that. Think of it as like the PC of the body. And then once it's interpreted what's happening, it sends the signal back down to your body, to that tissue, to that area of your body, the appropriate type of pain and the appropriate amount of pain back down to that area of your body, so that you, on a conscious level in your mind, can understand what is happening at that area of the body. Now, how crazy is that? That our brain, not our mind, our brain, the sciencey aspects, the physiological aspects, knows to send a signal down, the appropriate type of signal too, because we have itching, burning, dull, sharp, throbbing, nervy. We have all these different kinds of pains. Nociceptors, they're called pain receptors. It knows to send the appropriate type and the appropriate amount of pain to that area of the body. Now, here's where chronic pain can come in. When chronic pain comes in, and you've been dealing with this for a long time, whether it be from either normalizing yourself to this pain or band-aiding the pain with painkillers of some kind, this is where our pain odometer and the way our brain interprets that damaged area of the body, that disturbed area of the body, that can skew. What can happen, for example, is you could be in chronic pain and you could just be dealing with it, and your body somewhat gets used to that pain, so it eventually slows down that signal, or it dulls the intensity of that signal, because it's like, well, I've been sending this signal for a while and nothing's being done, so this must just be the regular state of that tissue now. So we're just going to start to slowly dial down the intensity or the type of pain that it is. We're starting to dial that signal down. So that's one example of how pain generation can be altered. Another example is relying on pain medications. When we start to go off them, or when our body starts to get used to it, we start to lower our pain threshold. So that signal that's being sent down to that tissue type where we're experiencing pain or discomfort, it starts to get used to the painkiller. Or when we go off it, it's so used to the painkiller that we start to feel the pain more. And what happens there is the pain signal goes up. The brain goes, there's tissue damage or disruption or dis-ease there. And yet I'm not feeling like there should be a signal coming down. That's what painkillers is, a whole other thing. But like, I've just gone off pain meds, for example, and there should be a heap of pain that should be felt here. And that signal hasn't been going down. So when you go off the pain medication, if that damage or dis-ease or disruption is still there in that tissue, the brain is going to up the pain odometer and send that signal down twice, 3 times as much. And so that's an example of how pain generation can be altered in an upward direction, intensified. And so we do have levels of pain generation that can be altered in certain circumstances, painkillers being one of them. Chronic pain and just dealing with it can also be another example of how the intensity can lower versus intensify. And so once we start to understand that this is how pain generation works in the body, we can start to have a deeper appreciation for the fact that our body's there to just communicate with us what's going on. And that when we either A, ignore it and just keep pushing through the pain, our pain perception is going to be altered and decreased. So our pain threshold goes up in a sense. Or B, if we band-aid it with a quick fix and don't actually fix the solution and get to the root cause, our pain perception can then go up later down the track when we, for example, go off pain meds, or for example, the issue comes back because we didn't treat the root cause. And so these are examples of how when we ignore the language of our body, what it's signaling to us, our pain perception or the issue can then either increase and get worse or decrease in some ways, but it still gets worse. As in, if my pain perception improves and the pain signal's dulling and not as intense, it's because I'm getting used to it, yes, but I'm actually pushing through the pain. And if my pain threshold has gone up because of that, because I've just been pushing through the pain and ignoring it and I've gotten used to it, then there's still a level of damage going on there. And if that damage continues later down the track, it is going to get worse because you're ignoring the problem. It's like having a disc bulge and continuing to work in the profession that's caused the disc bulge, and not doing anything to alleviate the pain, not doing any strength exercises to help surrounding muscular tissues to help that area, not seeing any specialists to get options on what your options are. And then later down the track, you end up having to have an operation that's far more invasive, far more risky. Like, this is an example. I'm not saying it's going to happen to you, but this is the example of what can happen when we A, band-aid up the issue. It'll get worse later down the track, numbing what our body's trying to tell us, or B, ignore the issue entirely. It's going to eventually get to you later down the track because you are not listening to your body. And so once we can learn that pain is actually there to guide us, not to harm us more, because the alternative is that we ignore it and then we end up harming ourselves more later down the track just by ignoring it or band-aiding up. Once we can realize that it's there to learn and to decode, we can really appreciate a newfound perspective of how to deal with our pain and discomfort. And this is where I come back to psychosomatics. What's lying there on an emotional, a mental, and energetic level? Yes, there is going to be a physiological explanation to everything, a medical or scientific explanation. I'm very well acquainted with that. I've had a lot of people coming into my clinic in discomfort over the 11 years that I was in clinical practice in my 20s. But that's only addressing the physical body. We're not addressing the emotional body, the mental body, the energetic body. And all 4 bodies is what makes up the entirety of the body. So when you think about it that way, when it comes to pain and discomfort, if you're only addressing it from a logical, scientific perspective and it's still coming back, it's still returning, there's still an issue, then that could be because you're only listening to a fourth of the entire body, as in you're only addressing the physical body, which is one of 4 aspects of the entire body. So maybe it's time to start listening to that other 75%. Enter psychosomatics and the metaphysical aspects of our body, which is the meat of this episode. That's what we're here to talk about. And so this is tip number 3. Remembering that number 1 was always listen to your body. Number 2, get familiarize yourself with pain generation and how it works so you can have a greater appreciation of what the body is actually trying to communicate to you. And number 3, familiarize yourself with psychosomatics and somatic education and somatic practices. Start to integrate this knowledge that you're learning from this episode with somatic work and somatic practices and somatic studies. And so what is psychosomatics? Psycho meaning mental, consciousness, awareness, the mental body. Somatics being physical body. And what it really means is that bridge between the physical body and consciousness. Consciousness being the opening gateway to our metaphysical bodies. So we have the physical body, the biomechanical, robotic aspect of us, the sciencey part, the part that gets us from A to B in our day-to-day. in our very real-time reality. But then we also have this gateway body, the mental body, our consciousness, our awareness, our mind. When we can start to pair what our body is communicating to us through signs, symptoms, pain, discomfort, bring it into our consciousness and our awareness and be very logically aware of that, we can then start to delve into the metaphysical doorways of our entire body. If we start to become aware and conscious of what that pain and discomfort or signs and symptoms is trying to tell us, we can then start to tap into how we feel about that, the emotional body. Is there stored emotion there? We can inquire, is there an emotion there? When I tap into that area of my body or that sign or symptom in my body, that presentation of dis-ease in my body. And then we can also start to inquire, what else is there? Is there a message there for me? A subtle energy shift? Is there a bodily sensation, which can often be a reflection, a mirror of energetics stored in the body? And so this is just examples of how we can tap into the other 75%, the other 3/4 of our body, outside of the physical body, that is. And so that's essentially what psychosomatics is. It's that gateway between the mind and the physical body. And that gateway is essential to tapping into the other 3 metaphysical bodies, being the mental, emotional, energetic bodies, and then physiological body being the other one. And so that's how I would tie together psychosomatics. Now, when it comes to integrating that knowledge and starting to move through thoughts, emotions, beliefs, stored energy, subtle energetic messages, the subtle body, the energetic body. This is where somatic embodiment and somatic practices comes in. Now, instead of talking you through a practice right now, what I am going to do is set you up with a bunch of resources in the caption below. There's going to be some starter somatic embodiment practices, all accessible and free to use on my YouTube channel. There's also going to be the Pain Body Decoder course, which is a mini course that I'm bringing out in February, very soon. And if you're watching this later down the track, it will already be available to you, so I'll link that in the show notes as well. And then through these resources, we can start to integrate and practice and inquire what's happening in our body, because somatic is body, but on a whole body level. We can start to delve through consciousness, through the mental body, that gateway, connect it to the physical body, start to inquire emotionally what's happening there, start to inquire on an energetic level, what's happening there? Are there any messages there for me? What's happening mentally? Is there a belief, a thought, a word that comes to mind? Start to inquire deeper than what's just happening in the physical body, especially when we've already had all the physical causes looked at, what could possibly be causing this, and no one knows. This is where we can turn to the metaphysical aspects and really start to process through them. I'm not saying to replace medical or health-backed information and resources out there to you and practitioners that are out there for you. What I am saying is that somatic practices and looking at the metaphysical aspects of the body, the other 3/4 of your body, is the other part of the picture. It's just making your relationship that you're forming with your body, especially when it comes to chronic pain and dealing with pain and disease, you're bringing in a more holistic, compassionate relationship with your body in a whole body level. You're not missing any piece of the puzzle when you're looking at all 4 aspects. And this is where somatic practices really do come in, to look at those other 3 parts of your body that is not the physical body and brings it all together beautifully. So I hope you enjoy the resources that I give you in the notes below. And I'm going to leave you with one somatic question, one somatic query. If there is currently a pain or discomfort that you're ignoring or overriding, or even a sign or symptom, it doesn't even have to be pain or discomfort. It could be a sign or symptom that you're dealing with right now. If there is something like that you are dealing with right now, how can we start to question internally, ask the body, what are you trying to communicate with me? It's that simple. What is it that you're trying to communicate with me? And then you can start to ask, is there a thought there, a feeling, a subtle sensation? Just take note of that. Go into it with curiosity. It's that simple. Just ask those questions, those 3 other bodies out of the 4 body questions. Okay, yes, there's a sign and symptom. Here's the type of pain it is, and this is the intensity of the pain or the discomfort or the symptom, whatever it is. Then starting to ask yourself, is there a thought there? A belief that's coming through? A stored memory? Is there a feeling there, an emotion? Is there some kind of subtle sensation or message, or just a known feeling, more of that energetic body coming through? Just ask yourself these questions. Tune into your body. Trust your body. Trust your instinct and intuition that comes through when you're doing this as well. That would be the last thing I leave you with. So you have my hot tips. I'm going to link them in the show notes below, the caption below. You'll have some resources below along with my Pain Body Decoder mini course, the link for that. And I will be seeing you next week where we talk about romanticizing yourself with sensory practices. I'll see you then. As we finish this week's episode, remember that you are your own rhythm keeper. So just keep listening for that rhythm and keep coming home to you. Until next time, with love, Shannon at Somatic Body.